basically, I will introduce interoperability in healthcare from a global perspective, because we cannot do today and run today telemedicine and using digital health without thinking to interoperability. So in this presentation, I will remind you shortly how the electronic health record is built, what is the importance of vocabularies and standards, and how we are building them. We will focus shortly on ICD-10 and DICOM as well-known standards and support for interoperability before moving to the body of this introduction to interoperability in healthcare. Will deal with HL7, V2, V3, and FHIR interoperability standards before moving to a very short introduction to FAIR as a framework, and before concluding and moving to the next lecture. So the electronic health record is classically built around the clinical documentation, orders and prescriptions, test and imaging results, and an important component for the last decades when we are talking about medical informatics, the decision support tools. So in the clinical documentation, we know that we have administrative and medical data from socio-demographic data related to the patient from a large round or a large range of perspectives, from the birth location to the living one, the marital status, the number of children, and more. And also we have all the clinical data related to medical exams, nursing assessments, and also something very important, the advanced directives like the contact in case of emergency or living wise. From an order and prescription side, we can manage, and we are managing in the EHR, all the laboratory tests prescribed by an MD, or the consultancy request to a specialist. And from the results side, we have for all the orders, all the results or the reports of laboratory results organized according to some standards like LOIC, or from an imaging perspective, we also are able to know for each patient the results of each imaging exam test, with also, and we'll go deeper in the next minutes, we can know details about the machinery used for making this exam, or more, having information about the team, which the medical team involved in doing it. So the decision support tools are nowadays in the EHR critical, meaning that we have guidelines for building also the EHR interfaces, but we have also in the medical room, or also at the pharmacy, drug and allergy detectors or systems allowing to detect drug allergy in the EHR according to some medical background, the drug-drug interactions related also to the medical condition, if we are looking, for example, to pregnancy, or more, drug and interactions to avoid with laboratory tests to run with imaging tests and more. And also the drug dose support for adapting and personalizing the drug delivery to each kind of patient. So EHR is a complex system like we talk about, and we need to understand that nowadays a lot of medical providers are using their own systems or business one, meaning commercial products, which are not fully adapted to their needs, but which are not always able to interoperate. So when we want to go further and deeper in EHR and to provide an interoperability between systems, meaning between the clinical side of the EHR and the radiological one, we need to look at the technical parts, at the technical components of the EHR, allowing moving data from and between systems, reducing the effect of distance between systems, meaning, for example, and it's a kind of dream today, how I can manage the EHR of a patient localized in Brazil when he or she is visiting Europe or Israel, for example. How can I deal with? So it's at this time something not real, but when we are going to work on interoperability from the technical perspectives on the EHR, we can think for the next years or decades to this kind of interoperability. More, we have issues regarding semantic, meaning that we need an understandability between systems, having the same standards, the same language for allowing exchange and integration of data, and more, the processes. We know that in each country, in each area in the world, we have local regulations, local needs, and the processes are different. But we need also to try to make some synchronization between these systems for allowing also exchanging data, information about the patient, about the population in an interoperable way. So when we are talking about EHR, we need also, and we want to talk about vocabularies as standards. In the medical field, we know that we are using nomenclatures for encoding medical acts, also for medical economics needs. We are using thesaurus or thesauri for dealing with some terminologies in the medical domain, and more. We are classifying disease. We are classifying medical situation with the International Classification of Disease for more than a century. So here, these standards are available all around the world, managed by huge organizations, and these vocabularies, these standards, are the fundamentals of the interoperability in healthcare. When we are looking at standards, we know all that we have organizations all around the world. The leading one, the ISO, the International Standard Organization, which is dealing and allowing to standardize standards to deal with standards in a centralized way, and allowing local organization to adapt and to fit these standards to the local needs. For example, the ANC, the American National Standards Institute for North America, for United States, and the CEN, the European Committee for Standardization, when we are looking at the Europe level. For example, in medical informatics, when we are talking about interoperability and interchange of health-related data, we have the ISO TC 215 for healthcare data. We have a similar standard in North America and the CEN/TC 251 in Europe. So the same standard can be adapted and is adapted for each area, translated according to some needs. When we are looking at not regular standard organization, we have organizations which are focusing on specific needs. And in medicine, in healthcare, we have different organizations dealing with terminologies like SNOMED or with data capture and interchange with the CDISC, IHE for supporting the communication between the different providers of devices, or OpenEHR for allowing developing EHR at low cost in an open perspective and supporting all the healthcare industry, or GS1, which is not related to healthcare directly, but allowing to track, for example, some medical samples, biological samples in labs. And we will talk about at the end of this presentation in the next 5 minutes, HL7, Health Level 7, which is providing a comprehensive framework of standards for allowing exchange, integration, sharing and retrieval of health-related data. So when we are talking about EHR and vocabularies, naturally we can talk about the ICD, the well-known International Classification of Disease, which is nowadays running this 11th version, in the next year, the 12th one. And here we need to focus on our need in clinics in encoding act. If you remember, ICD-9 was really, from my perspective, a good classification, but not too much precise. And when we are looking nowadays, and we are relating it to interoperability, ICD-10 is giving us a way to have more and an higher precision in encoding medical situation. For example, we have here an event which happened in 2016, fracture wrist, and we can encode with an higher degree of precision what's really happened. We know, according to this code, that it's a non-replaced fracture of the lunate bone in right wrist, and that is the initial encounter. And then a different date, and for example here, 2 months later, we can encode a new event, meaning that we can encode a fracture on the left side, or a subsequent event which happened also in the initial side, in the right side. So ICD-10 is also a standard nowadays for encoding medical situations, and with an higher degree of interoperability. What is important to see that is the codes are alphanumeric codes and not related to the local language, meaning that we are all around the world using the same code for the same medical situation, but we can translate it in any place, and it's allow also to increase interoperability between systems. A point and benefits and breakdown of ICD-10, for example, is that we have, like I pointed it out, very accurate data, but with a length of the code which can change. And also we can generate new situation, new conditions, but we can make it in a too much flexible way, and so not being able to communicate with other medical institutions. DICOM which is well known in the medical imaging world, is also a standard allowing interoperability in medical imaging systems. And all the files related to a patient, all image which we are generating with DICOM, provide us very precise information, data information, and knowledge about the patients, the reason of the visit and the test, the information related to the machinery, to the medical modality, the imaging modality used for running this exam, and how the data has been acquired and stored. And more, these data, when we are analyzing them later, they are giving us the opportunity to discover and to understand if the exam is a good one, a right one without noise, or if, for example, we have some issue in number of images, if it is related to the machinery and it's not pointing out issues or false alerts about medical conditions which are not real. So ICD-10 allow us as a standard to communicate between medical professionals without focusing on the language, and DICOM allow us to look at the medical conditions as defined and as acquired with an imaging system, but also exchanging data between systems in a standard, according to a standard architecture. So now, and it's a point here, we are now moving forward with HL7, V2, V3. It's a standard allowing exchanging, managing, and integrating healthcare information, both from the clinical and the administrative side. We are also, with HL7, providing standards for managing data, information, knowledge, and decisions in pharmacy or related to medical devices, to imaging, like we pointed out with DICOM, insurance transaction, and dentistry. So when we are looking at HL7, it's important to understand that the health level 7 relates to the ISO 7 layers model, meaning also the communication over the internet from the physical components of a network to the application, and considering data transportation and more. So communicating data between systems is related to interoperability of the systems specifically, and we can also be specific not to devices but to domain aspects, like following patients with diabetes or pregnant women, and also taking into account the semantic of the communication itself. So HL7 V2 was standard allowing to communicate this data, and you can see in the left side that it's not really friendly user. We cannot easily read it as human, and the HL7 V3 is based on an XML messages. It's relatively clear. We can, with the different tags, understand what is included in this message, but it's too much complicated to read and to fit with our needs. So in the last years, HL7 FIRE allow us to move more flexibly. FIRE is for fast healthcare interoperability resources, is a standard allowing us to exchange data without taking into account or without focusing too much in how this data is stored, and in a secured way. More, what it's important to understand that its FIRE is modular, meaning that we are building the blocks that we need. We are using the parts of the standard that we need, no more. It's readable for humans. It's also based on well-known technologies, and the most important, it's, from my perspective, it's also free and without restrictions, meaning that anyone can work with FHIR, and more, the EHR vendors are working with this, meaning that you can use a commercial product, but also you can add your own components if needed. Anyway, it's a very well documented and supported standard and framework by the healthcare internet community. And when we are talking about FHIR, you can see here that the resources are defined with specific blocks related to administrative data, finance, clinical perspectives, medication, not as a direct component of clinical one, but an isolated one, which can relate also to pharmacy, and technical issues. I want to point out before going forward that also in the administration, you can see a component related to animals and not only to humans. And we'll talk about in the next presentation regarding One Digital Health. So FAIR, it's allowing us to build and to manage resources efficiently. And the last point of this presentation is FAIR. FAIR is a guideline more globally, allowing us to deal efficiently with medical data. You can take a look to the paper of Wilkinson in Scientific Data, published 5 years ago. And the main points of FAIR are that we need to develop healthcare systems and allowing us to have data which are findable, which are described and defined in the right way. Data which are accessible, we can search and be able to retrieve the data easily. The most important point from this presentation perspective is interoperability. We need to use formal, accessible, shared, and broadly applicable language for knowledge representation. For example, like we talk about ICD-10, ICD-11, DICOM, so using well-known standards for being able to have data findable, accessible in an interoperable system, and also all the data generated must be reusable, meaning that we need to provide data in such a way that we can find, access, communicate them, but not only once. And using same data over time, not only from a technical perspective, but also from a legal perspective by providing the relevant usage license. So the take-home message for this presentation is that when we want to be interoperable in medicine, in healthcare, that we need a collective, a community involvement, and to be adaptable to change. In other words, you need to develop healthcare systems or to use systems which are developed using FHIR and which support data information and system findability, accessibility, interoperability, and reusability with FAIR. Thank you for your attention, and if you have questions regarding this presentation, you can contact me at the following email. So the second presentation of mine today is related to One Digital Health, or how improving connection between worlds. One Digital Health is a new framework that we have developed myself with my partners Dr. Oscar Tamburis from the University of Naples in Italy, with Catherine Schronacki from HL7 Europe, and with Professor Anne Moen from University of Oslo in Norway. So what is One Digital Health? We'll talk about shortly today. The presentation is around 3 main blocks, introducing the concept of One Health, Digital Health, and One Digital Health, developing the capacities and the new roles of citizens from the One Digital Health perspective, and how we will need to train the next generations of One Digital Health professionals, and who are these ODH professionals. So what is One Digital Health? So we have now a paradox of abundance of knowledge, meaning that all science fields are interconnected, and you don't have today specialists in a very specific field. Each one is dealing with different domains, subdomains of its specialties. We cannot be specifically dedicated to some specific issues. So more researchers and professionals are not more confined in their silos, meaning that the computer scientist is not dealing today only with computer science. He needs, for example, to have an application field in healthcare. So he needs to develop some expertise on healthcare data. The medical doctors or nurses or pharmacists or veterinarians needs also to develop some capacities with technologies, with robotic surgery, or with data analysis. So we have here to understand that we have the concept of One Health, which nowadays is allowed to interconnect, to have an umbrella view, an umbrella perspective about the human health, the animal health, and the surrounding environment. More, it's allowed collaboration between the different kinds of professionals in these fields, meaning clinical practitioners, public health workers, biologists, environmental scientists, and more. From the second side, we have the digital health, which is the evolution of technology for enhancing biomedical research and biomedical practice, both for personalized medicine and public health needs. So when we are looking at both together, we have the One Digital Health, meaning that One Digital Health is built around 2 keys: One Health and Digital Health, like I explained it a few seconds ago. And we can look at One Health or Digital Health and One Digital Health from 3 perspectives: from an individual health and well-being one, from a population and society one, and from an ecosystem one. Meaning that One Health is looking at the patient, at the animal as an individual, from a health perspective or its well-being needs. We are looking at populations from a public health perspective, for example, and in the ecosystem, how the environment is influencing our health. From the digital health, we are providing today applications and IoT devices allowing to follow a medical condition or to support a physical activity, enhancing well-being. We have a lot of internet-based systems allowing to follow the population health and behavior in some conditions. With the COVID-19 pandemics, we know that we had a lot of applications and systems allowing to follow the population activity and to manage accordingly more efficiently the activity. Ecosystems, we have a lot of sensors in our environment allowing to know what's happening. And when we are putting it together, we have One Digital Health support. But we need to look at One Digital Health according 5 dimensions. The first one is the human and veterinary healthcare. We want to get data about individuals, both humans and animals. We want to have some influence on them. And we can do it with an integrative perspective like the One Health one, and with digital tools. And there we have the One Digital Health perspective of human and veterinary healthcare. More, the healthcare industry, like we talked in the previous presentation, the healthcare industry must integrate and develop standards and interoperability systems allowing to collect data related to humans, animals, and their environment for supporting a better integration of this data and providing a personalized health support. From an environment perspective, we are living each one in a specific Earth area with some climatological influence, with food culture, with some social culture also of contact. So we need to take it into account. And then the two last dimensions, and from my perspective, the central ones when we are talking about One Digital Health today, is education and citizen engagement. We need nowadays to educate people also from kindergarten to university and during the life about this global interaction between humans and animals and environment. We know nowadays with COVID-19 that it's critical also for public health conditions. And the citizen engagement reporting using application. You can see here the One Digital Health steering wheel, and all of this allow us to deal with interoperability. Like you can see here, we need to involve the actors of health, patients, health providers, policymakers, vendors for developing the right tools. And we have a lot of products which are now using interoperability systems like we disclosed in the previous presentation. One Digital Health today is something critical, like I pointed out with the steering wheel. Also, with this pandemic, allowing us to data governance framework improvements, enhancing, allowing interoperability between systems, and taking healthcare forward. Nowadays, the WHO Europe and globally WHO are searching for empowering digital health or health care with digital health support. So how the citizen can help? We need, like I explained it before a few seconds, education and citizen science. We need to enhance and to engage citizens in health literacy. Citizen engagement also is allowing them to learn more about their condition and how they can impact on public health. For example, why it's important to be vaccinated. Citizens must be involved also not only on their own care, but in public health care, in veterinary health care, by looking at the patient. My dream is a well-known one today. I want to see in the EHR a simple question, not only if I'm smoking or if I'm making sport, doing sport, but if I have a pet at home, if I need to go out with him number of minutes today. It's a kind of physical activity. And all of this will allow us to develop better public health informatics, integrated informatics, and allowing the industry to look further. So when we are looking at One Digital Health, we need to consider what we pointed out with WHO and the Sustainable Development Goals defined for 2030. And we need to look at the digitalities, meaning human digitalities, digital animalities, and digital environmentalities, meaning that we need to look at each one of these perspectives from a digital way for allowing integrating data and taking healthcare forward by looking at human, animal, and environmental descriptions. So the next steps is to incorporate the new knowledge in all these dimensions in the framework as defined with ODH, establishing a systemic and integrated understanding of health, both for humans, animals in their ecosystem. And our current task is to validate this methodology, to take it forward with developing ODH scenarios for supporting public health analysis in these perspectives, supporting the integration of the different data for the different integrators and more digital healthcare developers, and globally training the next generation of healthcare practitioners or digital health practitioners to One Digital Health for giving an integrated perspective of health, looking at humans, animals, and environment as a whole and not from silos perspectives. More, if you want more details and if you are interested to go deeper with this subject, you have here the title of our paper published in Jmir at the beginning of the year, and you are also invited to connect by mail. Last but not least, you can also join us on LinkedIn. We have an European Federation of Medical Informatics working group on this, and we are looking for disseminate ODH philosophy and framework around the world. Thank you for your attention.